This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
All right, so good morning, everyone. I don't know if you guys are as tired as I am, but I feel tired today. So I wanted to talk today about RSI. You know, the mainstay for RSI for a really long time for the induction portion has been Etomidate. What are the issues with Etomidate? Does anyone know what are the things that Etomidate can cause as far as negative downstream effects? Anyone? No electrolyte issue, no.
I'm going to say bradycardia.
That's rare, but the biggest one everyone talks about is adrenal insufficiency. And so that's part of the reason why we don't really use it on kids, because they're more prone to it. And we always kind of poo-poo this in adults and like, well, does it really actually do anything nefarious in terms of outcomes? And we have had lots of studies that have looked at this, and the most recent one in 2023 showed that for every 31 patients that we intubate using Etomidate for RSI, one death is associated with that use. And so there actually is a downstream effect that we now feel is probably pretty real. And so there's another medicine that we can also use for induction. And anyone know what the other one that we can use? There's a bunch, but there's one other one that's kind of can be a go-to. Ketamine, right? And so ketamine, the biggest issues with ketamine is when you push it. Anyone know what the kind of two biggest pieces? So laryngeal spasm and bronchorrhea, right? So this increases your secretions and it can also cause laryngeal spasm. But the things that it can do, which are beneficial for a lot of our really sick patients, are it does nothing as far as your hemodynamics. It actually it increases your heart rate, and in some patients, probably not as much in shock patients, it actually creates like a catecholamine surge, and so you can theoretically get elevated improvement in blood pressure as well. And so they did a few head-to-head studies, and one of the most recent ones showed that ketamine may have beneficial effects in terms of RSI and intubation. And then there was a meta-analysis that looked back at all the studies that compared them and shows that maybe there is a benefit as compared to Etomidate. And so I think you're probably going to see more and more people using ketamine as the induction agent. And so the question then is, what are your dosings for Etomidate and ketamine when you're using it for RSI? Anyone? Yeah, so we always jump to 20, right? Because that's based on 0.3 milligrams per kilogram for Etomidate, right? And so for like a 70 kilo person, that's about 20, right? So that's kind of our go-to. For ketamine, it's 1 to 2 milligrams per kilogram. And in person with shock, you have that. And so it's 0.5 to 1. So, I think the big things to know are you're probably going to have folks asking for ketamine more often for RSI, and then also knowing that your dose is 1 mg to 2 mgs per kg, and so generally speaking, it's going to be between 70 and 100 milligrams of ketamine that folks ask for. The other thing with ketamine is that there's also it's been shown for folks who have like asthma and some, for COPD, there is a possible benefit from a respiratory standpoint as well, downstream effect. So I guess the takeaway on this today is just know your side effects for Etomidate and ketamine, and then know that, hey, when someone's asking for ketamine, the dose they're going to be asking for is 1 mg to 2 mgs per kg, and so you can check that work, especially when we're in a fast situation where the weights usually aren't in, and so we're estimating. So check the work quickly of the provider when they're asking for it. So, all right, well, let's have a glorious day, and hopefully we can all wake up.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.